Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. Graft versus host disease, also known as GVHD, is a life-threatening condition that can occur after a stem cell transplant or the transfer of stem cells from a donor where the donated cells begin to attack the transplant recipient's organs. This leads to significant morbidity and mortality. Now, to help support those living with GVHD, Incyte created the Incyte Ingenuity Awards in GVHD. It aims to support the GVHD community here in the United States by funding two novel initiatives that address challenges faced by people impacted by GVHD, including patients, caregivers, and healthcare providers as well. Well, we're joined by Dr. Muna Qayed. She's joining us here from Children's Healthcare of Atlanta to talk about GVHD and her winning project, a virtual rehabilitation program for children living with chronic GVHD. Welcome to Health Professional Radio, Dr. Qayed. Thank you for joining us.
Thank you for having me, Neil.
Tell us a bit about yourself and your role at Children's Healthcare of Atlanta.
I am a pediatric hematologist-oncologist and the director of the blood and marrow transplant program at the Aflac Cancer and Blood Disorders Center of Children's Healthcare of Atlanta. My specific clinical expertise and research focus is in the prevention and treatment of GVHD, which is a complication, as you mentioned, that can follow bone marrow transplant, where the donor immune cells mount an attack against the patient's body and can result in organ damage.
A virtual rehabilitation program for children with chronic GVHD. Tell us about your project, your winning project, if you would.
So we're really happy and excited about this project for our patients. More children are undergoing transplantation every year. There are more diseases potentially cured with transplant and more donor options. That, along with improvements in supportive care during transplant, has resulted in more children and young adults who are bone marrow transplant survivors. And they are at risk for long-term complications and toxicities and may be living with these toxicities, including chronic GVHD. With chronic GVHD, patients can have skin and joint involvement, weight loss, fatigue, many more symptoms. Our current practice is to have the patients meet with a physical therapist during their GVHD clinic visit. The therapist does a full assessment, and based on that, we refer them to outpatient physical therapy. Now, we often recommend this physical rehabilitation to improve functional capacity. However, their access is limited. So we try to help the families find a facility closer to home that accepts children and their insurance plan. And this can end up being a 45-minute drive or longer each way to get to a session. So if we're thinking of integrating this with the patient's daily life, that can be a challenge. And then for some other patients, there's often concerns regarding infection risk because they can be on multiple medicines that suppress the immune system. So based on that, we aim to implement a virtual rehabilitation program for children with chronic GVHD. In this program, our patients will meet with a physical therapist in our clinic. They'll devise an exercise program or plan to be designed to fit their specific fitness needs, as well as any other GVHD-specific needs. For example, if they have GVHD limiting their arm movements, then some of that exercise plan can address that issue. We will supply them with basic equipment needed, and then patients will have one-on-one home-based exercise sessions twice weekly for 16 weeks. These sessions will be live and will be done by a limited group of our physical therapists. So we think that the relationship and rapport built between the patient and their therapist can help them stay engaged and continue to attend these sessions. We will assess them to look for several fitness metrics, and then also their patient-reported outcomes. So how do they feel? What's their general symptom status? What's their sleep status, energy level, and mood? And importantly, during this 16-week period, the plan can be adapted as the patient progresses, what works, what doesn't work, based on their feedback, and also based on the therapist's assessments of what they need as they evolve in this program.
Did this idea come as a result of hearing about the award, or had your team been working on this idea for quite a while before you learned about the award?
This need we have identified for several years. We started our GVHD-focused clinic in 2015 at Children's Healthcare of Atlanta. And, a recurring problem has been that patients cannot access physical therapy. We serve the entire state of Georgia and some of our surrounding areas. So patients often travel several hours to see us. And in those rural areas, access to physical therapy, especially that is a facility that will take children, can be challenging. So we identified this need. And then the GVHD community is a tight-knit community, so we're lucky to have collaborators and colleagues who we talk to who share our interest in clinical practice and research focus. And so hearing about the Incyte Ingenuity Award through them and hearing about previously funded awards gave us the idea that, we have a need, they have the resources, and we can put those together to improve the lives of patients who struggle with GVHD.
So as far as improving the lives of patients, how much of an impact do you think your project is going to have for the GVHD community?
So, for the patients specifically who participate, we think this program can improve their physical fitness and quality of life. If this program is feasible the way we have set it up, then it can be adapted to fit the needs and structure of other pediatric transplant centers. In the future, we also hope to expand this beyond GVHD. So we want to implement this as a service we offer to all patients who undergo bone marrow transplant, who will likely benefit from improved fitness, even in the absence of having chronic GVHD. The point to remember, Neil, is this is about the patients. They are living with chronic GVHD. We want chronic GVHD to be part of their lives, but not their entire life. So we want them back in school. We want them doing the activities they want to do. And based on that and based on getting to know them, we can identify the issues that are coming up, the obstacles. So these can be identified by the patients, by their caregivers, and by their medical teams. So once we identify these gaps, the Incyte Award is one way, one opportunity to address this need and move the field forward.
And where can listeners go to get some more information about the Incyte Ingenuity Award and about your winning project as well?
This award and others are posted on the award website at www.incyteingenuityawards.com/GVHD. You can also go to the CHOA.org website to check out the details of how we set up our GVHD clinic, including the details of this project.
Dr. Qayed, I appreciate you joining us here on Health Professional Radio and giving us some of your time. Thank you so much.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Muna Qayed. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.